What we're going to do next is try to take his temperature. We'll see how cooperative he's going to be for that. What I usually do, today actually I'm using the 4-legged first aid kit, large kit, for our supplies. But I like to do trash management because when you're outside and things are blowing around, this will help keep your trash from blowing around. Usually take the bag and a clothespin and just fasten it right there to the bag so that I've got an easy way to store our trash. So for taking the temperature, we're going to need a thermometer, okay? Comes in a nice case. Be sure and clean it before you put it back in the case. So if we're going to take his temperature, we're going to need some lube because we don't want to hurt him as we go to take it. Now these little digital thermometers are pretty nice. All you have to do is push the button to start it, and when it beeps, you're done. You can read the number and then just push it again to turn it off. So what we are going to do though, I'll show you where we're going to put it here. This is going to be a rectal. We don't do it in the mouth because they'll just bite it off. But we're going to go back here to his rectum, and we're going to stick it in about an inch, inch and a half, about to there. All right, so we're going to open the lube. Put that in the trash. We're going to put a little bit on the end here. I'm just going to set this aside in case we need to use some more. So I'm going to have somebody help me hold him. I'm just going to have you kind of put your hand under his neck there. Okay. And I'm just going to have you keep him standing by putting your hand under there. Alrighty, just going to go back here and put it in. And I usually hold the thermometer to the tail so that if they move around, sit down, move side to side, I'm just following along with the tail. So there's not any problem there. I push the button and now I'm just waiting. If the dog gets restless, anytime I'm doing first aid on a pet, I start to sing because that seems to calm them down quite a bit. Now I'm no singer, but usually I pick Happy Birthday or the ABC song or Twinkle Twinkle Little Star or something like that I can remember real easily while I'm taking a temperature or putting a bandage on. Happy birthday to you, happy birthday to you. Happy birthday, dear bandit. Happy birthday to you. Normal range of a temperature is around 101 to 102.5 for a dog. And for a cat as well. Sometimes it'll get up to 103 when they're just nervous. Like I said, so I try to take it again. Here we go, we're all done. And his temperature is 101.1, so he's not very nervous. So let's give him a treat. He's been a good boy. You're being a good boy. Yeah, how about a treat for that? Thank you.
No problem.
Alrighty, so when you're done with your temperature, you're going to want to take your alcohol wipe and clean off your thermometer before you put it back in the case. Okay, so what we're going to do next is we're going to check for a heart rate. So we're going to show you how to do that. What I generally do is I'll make my hand in a U shape like this, and this works in small dogs or big dogs. And I'm just going to put it behind the elbow on the chest. Slip my fingers under one side, my thumb under the other, and just put my hand on the lower part of the body there. And you can feel the heartbeat. You can feel it on either side with your fingers or with your thumb. So once you feel the heart, you can count. You look at your watch, and I usually count for 6 seconds because I'm usually in a hurry. I don't want to wait for a whole minute. So I'll just usually count for 6 seconds how many beats there are. 2, 3, 7, 8. Okay, so that's 8 in 6 seconds. So I'm just going to multiply by 10 to give me 80. That's his heart rate. It's an easy way to do it. You can count for 15 seconds and multiply by 4, but in an emergency, it's easier for me to multiply by 10 and only count for 6 seconds. But you can do it a couple times and kind of get an average if you're not sure. So that's one way to check the heart rate. When you're checking for their respiratory rate, sometimes I'll put my hands on the sides. If I'm not seeing them breathing, I can actually feel the chest move. And then again, I'm going to count for 6 seconds. All right, so he's about 2 over 6 seconds, so 2 times 10 is 20. So his respiratory rate would be 20. 20 is a good resting heart rate. He's not very nervous, so it'll be lower. But if they've been running or they're nervous or they're injured, it's going to be panting. You're going to have panting, and you're not really even going to count that, so it's going to be high. Alrighty, so now we're going to check gum color. So what you do is you just lift the upper lip here, and you can see that he's nice and pink. So we want to see nice pink gums. If they're blue, they're not getting enough oxygen, and that's a real problem. If they're like red and muddy colored, they can have shock issues, so you want to watch that. Or if they're white, that's very bad. They're very anemic at that point, and they need to be seen right away. That can be life-threatening. What we're going to do when we look at the gums is you're going to take your thumb and just press over the canine tooth there, and they'll blanch white when you press. And when you let go, they'll refill again and be pink again. And you want them to come back to their normal pink color in 1 to 2 seconds. That's normal. If it's taking 3 or 4 seconds, that's abnormal. It can be signs of dehydration and anemia and circulatory issues. So you'll want to check that. Just be careful not to get bit, because again, you're working in the mouth right next to those teeth. So I would call the vet if they're not pink. You want them to be nice and pink. Any other color, I'd call your vet. So the basic database for pets are temperature, pulse, which is the heart rate, and respiratory rate, respiration. And then we go ahead and add in the gum color and the capillary refill time as part of the baseline. So those are things that you're going to want to write down and do when your pet is healthy, so you know what's normal for your pet. Then you'll know what's abnormal as well when it happens.